So as plastic surgeons, when we think of breast augmentation, we really think about increasing the size of the breast. That can have some effect on shape, not as much effect as a breast lift might, where we actually do something to tighten or change the shape of the breast. An augmentation is going to augment or increase what's already there. So you take the breast that you have and you're really just enlarging that and the features of the breast. At this point, 99% or more of the breast augmentations that we do utilize breast implants, either saline or silicone. In that other 1% or less, it is utilizing fat to augment the breast. Still pretty uncommon. It's not quite as good, actually not nearly as good as an implant in what it does, but there are certain circumstances in which we use that, or we actually use it in combination with an implant. Breast augmentation has changed quite a bit dramatically in the last 2 to 3 years, and it's all about the selection of implants. And then there's some about surgical techniques, things that we can do to decrease internal scarring and the tight tissues. So we didn't have all the information that we had now 10 years ago, and the implant changes are ones where the implants are actually put together more cohesive. They're a little bit thicker, they're less likely to ripple or be irregular, and even the shapes have shifted. 10 to 15 years ago, we didn't have many choices in the style of an implant. They were all just one width and thickness, and now they become higher profile or lower profile. Lots of things to discuss with your surgeon about the different options that fit your body. An ideal candidate for breast augmentation is going to be somebody who doesn't have any droop to their breast at present, or at least not a lot. And droop can be the areola and the nipple complex, or it can be the actual breast itself. Sometimes the gland of the breast hangs down below the crease. And an implant's not necessarily going to make that better unless you go really big. So the ideal candidate typically has a nice shaped breast and needs only an increase in volume. It's really uncommon for us to see somebody who has a lot of dissatisfaction with a breast augmentation. It's really an operation where people are happy. It's just a question if they could be happier. And that often comes into size. People want to be a little bit bigger or a lot bigger or smaller. What we do, which is really unusual, is we actually warranty for the first 3 years the size choice. In that, if someone decides they want to go bigger, I, as a surgeon, I'm going to come back and I'm going to replace their implants, put in bigger implants without a surgeon's fee. So I'm not charging for that procedure in the first 3 years, although there's still the cost of buying the new implants and paying for the time in the operating room and the anesthesia that it takes to do that procedure. And that takes some of the pressure off of people to just say, okay, my gosh, I've only got one shot at this. No, you're probably going to get it on one shot, but if you don't, we have this little wiggle room here. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel, and for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.